Hello everyone, and welcome to today's educational session on how traditional Chinese medicine TCM understands the eye and its associated disorders. Whether you're a student, practitioner, or curious health enthusiast, this deep dive into Chinese medicine's view of the eye will enrich your appreciation of holistic care. In Chinese medicine, the eye is much more than a sensory organ. It's considered a direct reflection of the state of internal organs and the flow of qi, vital energy, blood, and fluids. Liver. The liver is known as the organ that opens into the eyes. It stores blood, and its state determines the eye's visual acuity. The liver's ability to maintain a smooth flow of qi is also vital in preventing issues like eye pressure and spasms. Kidney. The kidney stores Jing, essence, which supports the marrow and brain. The optic nerve is thought of as part of the brain, now, and therefore kidney essence plays a key role in nourishing vision, especially with aging. Heart. The heart governs blood and the Shen spirit. Visual perception, clarity, and the brightness of the eyes relate to heart health. Disturbed Shen can manifest as hallucinations or distorted vision. Spleen. The spleen governs transformation and transportation of fluids and helps generate blood. Weak spleen function leads to inadequate nourishment of the eyes. Lung. While less directly associated, the lung governs qi and helps push fluids upward. It also helps the eyes resist external pathogens like wind and heat. In TCM, the eye is the orifice of the liver, but its vitality is rooted in the essence of the kidney, nourished by the blood of the heart and stabilized by the spleen. Healthy vision relies heavily on blood and yin. Blood moistens the eyes and supports visual clarity. A deficiency in blood can lead to dryness, floaters, blurry vision, or even night blindness. Yin, particularly liver and kidney yin, cools and nourishes the structures of the eye. A deficiency in yin may lead to redness, photophobia, and ocular degeneration. Pathologically, when yin is deficient, yang may rise, manifesting as pressure, redness, or inflammation in the eyes. When blood is stagnant, it can block vision or cause sharp pain. Let's align common Western eye diagnoses with Chinese medicine patterns. For instance, glaucoma corresponds to TCM patterns like liver fire rising, liver yang rising, or phlegm damp obstruction. Symptoms include a pressure sensation, headache, and red eyes. Treatment involves clearing liver fire, subduing yang, and resolving phlegm. Cataracts are linked to kidney yin deficiency, liver blood deficiency, or phlegm misting the orifices. The treatment focuses on nourishing the kidney and liver, transforming phlegm, and opening the orifices. Dry eye syndrome is associated with liver and kidney yin deficiency or lung yin deficiency. The treatment aims to nourish yin and moisten dryness. Macular degeneration and diabetic retinopathy correspond to spleen and kidney qi deficiency, blood stasis, and damp heat. Treatment involves strengthening the spleen and kidney, invigorating blood, and clearing damp heat. Scalp acupuncture has shown promising results, especially in optic nerve atrophy and retinitis pigmentosa. Techniques use the visual cortex area based on modern neuroanatomy mapping. Herbs, Ju Hua, chrysanthemum, clears liver heat, brightens eyes. Gou Qi Zi, lycium, tonifies liver and kidney, nourishes blood. Shi Hu, dendrobium, nourishes yin, clears deficiency heat. Qingxiang Zi, lowers liver fire, clears vision. Cheiqian Zi, clears damp heat, promotes urination, benefits the eyes. Classical formulas for eye conditions include Ming Di Huang. This is often used for chronic degenerative vision issues stemming from liver and kidney yin deficiency. Qiju Di Huang. This one is particularly helpful for visual fatigue and blurry vision. Longdanci Gantang. It's typically prescribed for red, painful eyes caused by liver fire. Zhen Wutang. This formula is used for blurry vision that results from fluid accumulation. Studies have begun to validate these traditional approaches. A randomized clinical trial showed that electroacupuncture improved ocular blood flow in patients with optic atrophy and supported retinal function. Herbal formulas such as Ming Di Huang have demonstrated anti-inflammatory and antioxidant effects in animal studies, supporting its use in age-related eye degeneration. Meta-analyses from Chinese and Japanese institutions report faster recovery times and improved quality of life when integrating acupuncture with standard ophthalmologic care. In conclusion, Chinese medicine views the eye as a reflection of the internal harmony among the liver, heart, kidney, spleen, and lung. Disorders of the eye are seen as imbalances of qi, blood, yin, and yang, all of which are treatable through acupuncture, scalp therapy, and especially herbal medicine. When aligned with modern diagnostics and supported by emerging scientific research, TCM offers a powerful integrative model for treating eye disorders holistically. Thank you for joining me, and remember, vision isn't only through the eyes but through insight into how the whole body speaks through them. In conclusion, Chinese medicine views the eye as a reflection of the internal harmony among the liver, heart, kidney, spleen, and lung. Disorders of the eye are seen as imbalances of qi, blood, yin, and yang, all of which are treatable through acupuncture, scalp therapy, and especially herbal medicine. When aligned with modern diagnostics and supported by emerging scientific research, TCM offers a powerful integrative model for treating eye disorders holistically. Thank you for joining me, and remember, vision isn't only through the eyes but through insight into how the whole body speaks through them.